Thanks, Mark. Good morning, everybody. It's so great to have you here this year. Thank you for joining us at the Innovation Conference. My job, as always, is to give you an update on what's been going on in the compliance world. And of course, if you sponsor a group health plan, you know there's always something, right? So today we will cover some developments in the judicial branch, in the executive branch, the regulatory agencies, and we'll see what's coming out of Congress, and then I'll give you a brief update on what's been happening with the Affordable Care Act. As I go through this presentation, you're probably going to be thinking, oh my gosh, there's so many things to know. There's so many things that could go wrong. So I'll help you with all those things if I can, but I also thought it might be interesting to take a look at other situations in life, not of a compliance nature, where things can possibly go wrong. Take, for example, this wolf. Well, wolves for millennia hunted for their own food. You know, they didn't have anybody to help them, but at some point in time, at least some subset of the wolf population saw cave people sitting around fires and thought, hey, those guys have food. This hunting business is kind of hard. I'm gonna go see if they'll give me some of their food. What could possibly go wrong with that? Well, as it turns out, quite a lot. And here's another situation where something is about to go terribly wrong. And I don't know, what could happen if you put a tank museum next to a bunch of monkeys? And I don't know, if it were me, I would probably store one of these tubes in a different drawer. Okay, so what could go wrong with this? For me, quite a lot. I mean, I would be in this endless loop trying to figure out which numbers go with which arrow. And it is kind of, subject to interpretation. And then sometimes things go wrong with labeling. I'm not sure why we needed this many interpretations, especially when the interpretation is the same as the original. And this is just an example of a company messing with people like me. See what they've done there? The blue is labeled red, and the red paint has a blue bottle. And the blue paint has you get it. And then ideal for sharing, but it only serves one. Okay, so let's take a look at what's been going on in the judicial branch. Well, if you were here last year, you know that we talked a lot about these fiduciary lawsuits. So ERISA is the federal statute that governs, among other things, self-funded health plans in the private sector. And one of the things that ERISA requires is that fiduciaries, and those are plan sponsors who offer a self-funded health plan to their employees, have to behave in a prudent manner. So we've seen a number of lawsuits, including the Wells Fargo case, in which plan participants or former plan participants are suing the plan sponsor, alleging that they breached that fiduciary duty. And in all of these cases, the allegation is that the plan sponsor did not properly manage their pharmacy benefit manager. We've talked a lot about PBMs, but for those of you who don't deal with them on a regular basis, they're really just a middleman of sorts between the drug manufacturers and health plans. They facilitate the purchasing of drugs by plans. And the PBM market is really controlled by three big players: Express Scripts, CVS Caremark, and Optum. About 80% of the market is with one of those three companies. And they do business on what we call a traditional platform, in which they don't charge a flat fee per employee per month or per prescription per month. Instead, they put their revenue on the cost of the claims that the plan is purchasing. So it's kind of hidden revenue. It's really hard to see, and therefore it's hard to control. And they also typically retain some or all of the rebates, which are simply amounts that the drug manufacturers provide to plans when the plan participants purchase their drugs. So in the Wells Fargo case, this is a class action lawsuit filed by some former plan participants. They alleged that Wells Fargo did not properly manage their prescription plan because they let Express Scripts charge excessive fees, and they let them charge more for drugs, a lot more for drugs in some cases, than the plan participants would have paid if they just went to the pharmacy and bought the drug without even having insurance. So, since our last conference, what has happened in this case is that it was dismissed for lack of standing because the court said that there really wasn't enough of a nexus between the alleged behavior of the plan sponsor and the PBM and the ultimate harm to the plan participants. So what they had said was that the end result of Express Scripts behavior is that they had to pay more in out-of-pocket costs. Okay, so the court was sympathetic to their argument, but they just didn't think that there was enough standing there. So, similar case, Johnson & Johnson, again, class action lawsuit, again involving Express Scripts, and again dismissed for lack of standing. So in this case, the lead plaintiff had met her out-of-pocket maximum for the year. So regardless of what happened in the lawsuit, she wasn't going to recover anything. So I'm not sure why the law firms who selected these plaintiffs selected the ones they did, but I think that they're honing their skills in lead plaintiff selection. Another case, Knudsen versus MetLife. So the allegation here was that the plan sponsor, by retaining rebates as a company and not passing them through to the plan or the plan participants, drove up the cost of the plan for the plaintiffs. And again, the court said that there wasn't enough of a connection there. They did leave open the possibility that if they alleged more particular injury and could show that connection, that the case could move forward. Okay, so is this an end to this kind of fiduciary duty litigation? I say no, for a couple of reasons. One, we've got the J.P. Morgan case. Okay, and this case is the same law firm as the one that sued in J&J, and this time they picked a plaintiff that had not yet met their out-of-pocket maximum. And even though Wells Fargo and J&J were dismissed, they were dismissed without prejudice, meaning they could amend their complaints, and they're doing so. So if these cases proceed to the merits, then I think we're going to see more litigation like this, not less. So what are some things you can do to avoid being a defendant in one of these fiduciary duty lawsuits? Well, if you use a pass-through PBM, one that charges fixed fees and doesn't retain rebates, then you're already way ahead of the game. And most of our clients are already doing that. You want to make sure that your PBM is not charging excessive fees. You want to make sure they're disclosing all of their income. You want to check the market every once in a while. Make sure you're getting good value. Make sure your employees are satisfied with their PBM. Do some benchmarking. Make sure your plan's not out of line in terms of cost with what is out there in the marketplace. You can even establish a fiduciary committee to make sure those things are happening. So these are best practices, even if you're not in a ERISA plan. Interestingly, Duke University did a study of over 200 ERISA plans, and they found that a third of them had not done a market check in recent memory, had not done any benchmarking, had not checked employee satisfaction, and their conclusion was those companies were leaving themselves open to a lawsuit like this. Okay, so that's the fiduciary duty lawsuits, and we're also seeing litigation involving insulin pricing. So there have been hundreds of lawsuits filed, and in these cases, the plaintiffs are accusing the manufacturers of insulin and the big PBMs, the ones I just mentioned, of colluding to keep the price of insulin high so that they can maximize rebates and maximize their discounts. Some of you have probably been approached by law firms asking if you want to be involved in one of these cases. And they're typically being brought by self-funded employers or by states and sometimes by individuals. And the federal lawsuits have been consolidated in some multi-district litigation in New Jersey. Just in the last week or so, there have been some rulings in these cases, and the motions to dismiss have all been denied, so it looks like these are going to move forward, at least some of them. So we'll see what ends up being recovered at the end of the day. I don't know how much you know about class action lawsuits, but Frank would probably agree with me that usually the entities who do the best are the law firms who get the class certified. Okay, so we've also seen litigation on tobacco surcharges. So a lot of employers have a tobacco surcharge, so it's just a higher premium for people who use tobacco. A lot of employers don't realize that that is actually considered to be an outcomes-based wellness program, which is the most heavily regulated kind of wellness program. So when you have a tobacco surcharge, what you're supposed to do is offer a reasonable alternative to anyone who can't satisfy the standard of being a non-tobacco user. And typically that reasonable alternative is allowing them to achieve the reward, which is the lower premium, if they complete a tobacco cessation course. And then what you're supposed to do is, once they complete the course, you give them all of that premium back, the higher premium they paid, back to the beginning of the plan year. So what happened in these cases is the employer did everything right except for that piece. They didn't refund the surcharge back to the beginning of the plan year. So if you're doing a tobacco surcharge, just keep that in mind. The Change Healthcare cyber attack that we talked about last year has resulted in a lot of litigation. So Change Healthcare is a company owned by United Health Group, the same company that owns United Healthcare, and they facilitate a lot of transactions in the healthcare universe. And when this happened, there was a lot of disruption. People weren't getting EOBs, providers weren't being paid, but also there was a very significant data breach. So the estimates are that over 190 million people had their data, their personal health information, or just their personal data compromised. You might have gotten a letter saying you were involved in this data breach. And there are over 70 class action lawsuits going on right now, alleging that Change Healthcare didn't do enough to protect that data. And those cases the federal cases have been consolidated again in multi-district litigation, this time in Minnesota. And then we've also seen litigation on the No Surprises Act. So the NSA is a federal statute that was passed a few years ago, and what it does is it prevents providers from balance billing members if a member uses an out-of-network provider in certain situations, including air ambulance claims. So if somebody has an air ambulance claim, just using that as an example because that's the issue that came up in this lawsuit, and the plan makes its payment and the member pays their cost sharing and the provider still doesn't like what they've been paid, then they can't balance bill that member like they used to be able to. But what they can do is when there's a disagreement, the plan can offer the qualified payment amount, the QPA, which is supposed to be the median contracted rate for the service that is at issue in that geographical area. And then if the provider doesn't like that amount, they can trigger independent dispute resolution, IDR, which is a form of binding arbitration. So the IDR entity gets to select which amount they think should be paid. And in the Guardian Flight case, an air ambulance provider didn't like or was awarded an amount from the IDR entity, and the plan still wasn't paying what they were told to pay. But in this case, the Fifth Circuit Court of Appeals said, no, there's no independent right for you to bring a lawsuit to enforce that payment. Your remedy is to complain to the Department of Health and Human Services, and they can apply administrative penalties. And then a little more litigation regarding the NSA. So the Fifth Circuit again, the full Fifth Circuit, is going to reconsider its earlier decision by a three-judge panel of the Fifth Circuit in the Texas Medical Association case, in which the regulations that were issued regarding how QPA is calculated were vacated, and in the meantime, the agencies, when I say the agencies, I mean the tri-agencies, which is Department of Health and Human Services, Department of Labor, and the IRS. Those are the three federal agencies that really take care of most healthcare compliance. The agencies have announced that they're not going to enforce the final regulations on the QPA until this judgment comes down. So plans and insurers are allowed to use a good faith interpretation of the statute and the part of the regulations that was not vacated. Okay, so let's look at some other situations when things have gone or could go very wrong. So if you're a dentist and you're, putting up a sign advertising your practice, you might want to just make that a little clearer what you're doing. And then, I don't know, they might want to use a different color on the key word there. And then I'm thinking one more word might have been helpful here. Maybe the word "and" before children. Okay, this one, it took me a minute. But you're supposed to follow the recipe step by step, starting from number 1, proportionately. And what I really like about it is that these are the most popular basic recipes. And then I have a few examples of people who had put together advertisements or signs, and they don't realize that in the English language, we generally read from left to right and not from top to bottom. And sometimes the end result is rather unfortunate when they don't realize that. Kind of changes the meaning a little. This one's especially unfortunate. Whoops. Hope nobody was paying attention. Same thing here. I'm pretty sure that was not the meaning they had in mind. And then I'm pretty certain somebody lost their job over this one. And if you're a university and you want to brag about how much of your operating budget goes toward financial aid, you might want to have your math department double check your ad copy. Okay, so what's been going on in the executive branch? So this is where the regulatory agencies reside. Well, of course, we have a new administration in the White House, and they didn't waste any time getting busy on the compliance front. And one of the first things that the Trump administration did was to issue Executive Order 14219. And that executive order directed the agency heads, not just the 3 that I mentioned, but all agency heads, to identify certain categories of unlawful or potentially unlawful regulations and to repeal them. And the executive order said, hey, if you have to, you can use the Administrative Procedures Act to dispense with the normal methodology that the agencies use when they repeal regulations. So this has relevance for all of us because it is actually helpful in the area of mental health parity. So mental health parity rules have been around for a long time, and they basically require plans to be no more restrictive with respect to mental health and substance use disorder benefits than they are with medical and surgical benefits. And in 2021, as part of a big piece of legislation called the Consolidated Appropriations Act, Congress said, you health plans, you have to look now at your plans to see if the non-quantitative limitations within your plan, so things like pre-cert, prior authorization, step therapy, are on par for mental health and substance use with medical and surgical. And you have to write up this analysis and you have to have it on file in case we come and audit your plan or one of your plan participants wants to see your analysis. So we've all been busy doing that. But last fall, after our conference, final regulations on mental health parity were issued that were going to make that analysis much more difficult. And it was going to cost plans a lot of money to do that. We've had companies give us estimates from $5,000 to $20,000. So thankfully, a lawsuit was filed by an industry committee called ERIC, and they challenged the regulations, said that they were ambiguous and they exceeded the agency's authority, and also, in light of the executive order that I just referenced, the agencies asked the court to suspend the litigation while they reconsidered those final regulations, and they announced that they were not going to enforce that part of the regulation. So yay, you caught a break there. Hopefully we don't ever have to do that, but if you haven't done the original NQTL, you really should be doing that, because that's still in effect. That was a statutory requirement. Transparency and coverage was a big initiative of the first Trump administration. So there were two sets of rules, one directed at hospitals and the other directed at plans and insurers. The hospital rule went into effect in 2020. Hospitals were supposed to put out on their public website the negotiated rates, so the rates that they've agreed to pay different payers like United Healthcare, Anthem, et cetera, for 300 of their most common services. And then the rules that were directed to plans and insurers were phased in over a couple of years. And you may remember those machine readable files that you were supposed to put out on your website, and you're supposed to have a self-service pricing tool that allows plan participants to see how much it costs to have a service done at one provider versus another. Your TPAs are probably taking care of most of this for you. So, not surprisingly, enforcement was lax during the Biden administration. And so the Trump administration has ordered the agencies to get on it, start enforcing the existing transparency rules, and find ways to expand them. So we're expecting some new regulations regarding the machine-readable files, probably next month. And I wouldn't be surprised to see some regulations that expand transparency to prescription drugs. Some other initiatives by the Trump administration regarding drugs. Well, we're all aware of the tariffs that have been on again and off again. So one of the things being contemplated is tariffs on prescription drugs. And the estimates that have been thrown out there by the administration have been anything from very small to 250%. And bear in mind, the majority of prescription drugs that we use here in the United States, either in final form or the ingredients of those drugs, come from overseas. So there's a lot of potential to drive up cost here. The Trump administration is also putting pressure on the drug manufacturers to give most favored nation status to Medicaid, and also encouraging them to do that with respect to Medicare and private payers. They're probably not going to do it, but most favored nation status would be charging the US what they charge other countries, because the drug manufacturers charge other countries less for the same drugs than they charge the United States and commercial payers. A few other things, there have been some executive orders. One that directs HHS to set up a mechanism for making it easier for individuals to buy drugs internationally. They want to create a stockpile of the active ingredients in the most commonly used generic drugs, because most of these, I think I saw an estimate of about 80% of these come from China. And the fear is that there's going to be some kind of, a trade war or international incident, and our drug supply is going to be disrupted. And then lastly, the administration has directed the Department of Labor to issue regulations to make PBMs more transparent. Gag clause attestations. So again, as part of the Consolidated Appropriations Act a few years ago, plans now have to certify to CMS, the Center for Medicare and Medicaid Services, every year that their vendor contracts don't contain any gag clauses. And a gag clause is one that prohibits the plan or the insurer from disclosing the amount paid and certain information about the quality of services that are being paid under the plan to individuals who have a legitimate need for that information. So the new thing here is there's been some guidance that says that not only do you have to certify your contracts don't have gag clauses, but you have to certify that downstream agreements, such as an agreement between your TPA and the network that you use, don't have any gag clauses. And if they do, and you're supposed to ask them to remove that, and if they won't, you're supposed to let HHS know, or CMS rather, that there's a gag clause in a downstream vendor agreement, and you tried to get it removed and you couldn't. So you got to kind of tell on them. Medicare Part D rules. So as part of the Inflation Reduction Act of 2023, a lot of things changed about Medicare Part D plans. Those are the prescription plans that Medicare participants can enroll in. And most of those changes went into effect in 2023, but there are some that, 2025, but there are some that go into effect next year. And how this affects all of you is that you have to provide those notices of creditable or non-creditable coverage every year. And it really doesn't matter from your perspective whether your coverage is creditable or not, but the important thing is that your Medicare eligible employees know which type of coverage they have. So if it's creditable, that means your plan pays out at least as much as a Medicare Part D plan would pay. The reason it's important for them to know is that when they turn 65, if they don't enroll in a Medicare Part D plan and they're not enrolled in creditable coverage somewhere else, then when they ultimately do enroll in a Part D plan, then they would have to pay a penalty, and they would have to pay that penalty for the rest of their lives. So it's important to get that right, and because the Medicare Part D plans have changed and are changing again, I would ask your carrier to either test your plan or let you know whether or not your status has changed before you send those notices out. Last year we had some new HIPAA privacy regulations involving reproductive health care. So if you are a covered entity under HIPAA and you had a request from somebody for protected health information that was reproductive in nature, you were supposed to make that requesting party attest that they weren't going to use that information for an illegal purpose. So in the Pearl case, the federal district court actually vacated that rule, so we don't have to worry about those anymore. But there was a part of the rule that requires some additional language in HIPAA privacy practice notices involving substance use disorder, and that part of the regulations is still in effect. So you will have to update your privacy practices notices by next year. Okay, just a couple of other things. Association health plans, this was a big push during the first Trump administration. It's the ability for private sector employers to do what some of our governments have done, like the big health plan down in Memphis, the schools and the cities down there. It's really hard to do that in the private sector because of the MEWA laws, Multiple Employer Welfare Association laws. So the association health plan rules were going to make that process easier. And those were repealed during the Biden administration. We may see them resurrected during the Trump administration. Also, short-term health insurance plans. So these are plans, it was part of the original ACA where certain short-term plans could be purchased that did not have all the ACA provisions in them, so they didn't have all the services that the ACA requires of individual plans. And they didn't require things like pre-cert to be removed. So during the first Trump administration, they made it such that individuals could purchase them for a longer period of time, and then the Biden administration repealed that. So now we're going to see some new regulations making those longer again. So on again, off again, depending on who's in the White House. So that's the executive branch. What else can possibly go wrong? Well, for me, this would mean canceling the transaction multiple times before realizing that the colors are wrong. Okay, some design examples. So the really disturbing thing about this one is that it's the neighborhood design center that designed that sign. What could go wrong if you put mirrors on the ceiling of a public restroom? And unless you have arms that are like 7 feet long and can bend at awkward angles, this has gone terribly wrong. And I'm not really sure how that happened. And I'm not sure this is really going to work. It's missing something. And I just want to know, why not the A? And then in designing forms, sometimes there needs to be just a little more thought put into it. I mean, I get what they're trying to do here, but and then, I mean, isn't there an easier way? You want to get a picture of it? Take your time. All right, so what's been coming out of Congress in the compliance world? Well, we had the one big, beautiful bill that was passed in Congress on July the 3rd, signed into law by the President on the 4th of July. It was the extension of the Trump tax cuts, and it also resulted in cuts to a number of federal programs, including Medicare, Medicaid, and ACA subsidies. Beginning in 2027, there will be work requirements for Medicaid participants, and the estimates by the Congressional Budget Office are that about 10 million people will probably lose their coverage over the next 10 years. Now, there are some COVID-era tax credits that are set to expire at the end of this year, and if they expire, the cost of individual coverage in the marketplace is going to skyrocket for a lot of people. So if that happens, you're going to see a lot of people dropping their plans. But it sounds like Congress is working on a deal there, so we'll see what happens. My guess is they'll probably be extended. So that's the bill generally, but it did actually have some little nuggets in it for group health plans, especially qualified high deductible health plans. So those are the plans that you can couple with a health savings account. And they generally require that all services get applied to the deductible before the plan pays anything, except for certain preventive care services. So one of the things that the OBBB did is it made permanent a safe harbor that was enacted during COVID that allowed qualified high deductible health plans to cover telehealth, even for non-preventive services, prior to the deductible. So that had expired, but it has now been permanently extended, and it's actually a retroactive change. So if you wanted to, you could go back to January the 1st of this year and add that coverage in if you have a HDHP. Direct primary care. So this again involves qualified high deductible health plans. So direct primary care is where you pay a set amount a month to a primary care practice, and then you get all your primary care for free. And what the feds are allowing here is up to $150 in direct primary care a month for single and double that for family, without being disqualified for an HSA. And you can also use your HSA to pay for that direct primary care up to those amounts. And again, this is effective in January 26. They are extending the HSAs to bronze and catastrophic level plans in the marketplace, which a lot of people are enrolled in. So this is a huge expansion of HSA eligibility. And that's effective also in January. And then this one probably affects a lot of you. So if you sponsor a flexible spending account for dependent care, the amount that employees have been able to put into that account for the last 40 years has been $5,000. Now, we all know the cost of daycare has gone up in the last 40 years. So they're finally adjusting that upwards by $2,500. And that is effective for your plan years beginning in January. And then also there's still scrutiny going on in Congress of PBMs. So the House is still holding hearings, and there have been numerous attempts to do some bipartisan reforms of PBM practices, and one almost passed at the end of 2024 as part of a bigger bill to keep the federal government open, but they took it out at the last minute. But there are some bills that are working their way through Congress, and I really expect that we're probably going to see some PBM reform. The states have really taken the lead on this. For whatever reason, the feds haven't been able to get it done. Okay, what else can go wrong? Well, when you ignore the orange cones, bad things can happen. This person's going to be late for work, I think. And then when you lock your keys in your car, and the company that comes to get you into your car also locks their keys in their car, that's a bad day. And then every once in a while, you decide to go out on a limb and do something really different and get a short pixie haircut. And it doesn't go so well. And I don't know about you, but I don't have any luck with shopping online for clothing. It usually ends up more like this, or this. Pretty sad. And then, that's a complicated recipe. If I tried it, that would probably be more what it looked like. They tried. Okay, last but not least, the Affordable Care Act. So I always like to share this slide to show how popular or unpopular the ACA is. And as you can see, it has grown in popularity over the last year or so. And that is why you're not seeing the Trump administration talking about repealing and replacing the ACA, because it is popular and growing in popularity. And every year, certain things about the ACA are adjusted. One of those is the out-of-pocket maximums. So this is the maximum amount that you as a plan can charge on an in-network basis for copays, deductibles, and coinsurance. You can see what the amounts are for 2026. They're going up from this year. Affordability applies to applicable large employers. So if you have 50 or more full-time employees, then you have to offer affordable coverage. And by that they mean the single premium for your least expensive plan cannot exceed a certain percentage of your employee's total household income. And after going down 3 years in a row, in 2026 it is actually going up to 9.96%. And then the employer shared responsibility penalties, those are the penalties that you as an applicable large employer might have to pay if you either didn't offer a plan or you did offer a plan, but it was considered to be unaffordable or to not have minimum value. And in either of these situations, either with the A penalty or the B penalty, the A penalty is what would apply if you don't offer a plan. The B penalty would apply if you do, but it doesn't meet those standards. One of your full-time employees would have to go to the marketplace and get subsidized coverage before a penalty would apply. PCORI fees, so this stands for Patient-Centered Outcomes Research Institute, and it's the one remaining ACA tax. It is assessed on self-funded health plans and on health reimbursement arrangements that are sponsored by employers who have fully insured plans. It was supposed to have sunsetted in 2019, but it got extended 10 years, so it'll be with us at least until 2029, and I wouldn't be surprised to see it extended beyond that. It's not a ton of money for most employers, but it's just kind of a nuisance. And when you think about all the plans out there, not only self-funded plans, but insurance companies who offer plans, that's a lot of revenue they're collecting. I don't think they're going to give that up easily. The fee next year has not been announced if your plan year ends in October, November, or December, but if your plan year ends in any other month, then by next July 31st, your fee is $3.47 per covered life. Okay, the non-discrimination provisions of the ACA. So these apply to covered entities, which in this context means plans or insurers who receive money from the Department of Health and Human Services in some form. Where it usually comes up with self-funded plans is if you are a public entity and you have an ambulance service, and that ambulance service accepts Medicare and Medicaid, which ultimately comes from the Department of Health and Human Services. So the question has been for a while now whether the discrimination that is prohibited on the basis of sex means that plans can't outright exclude services related to changing gender. So this has been on again, off again, and the final regulations that were issued in May of 2024 that said you can't do that, you can't exclude those services if you're a covered entity, were there was a nationwide injunction issued on those a couple months after they were implemented. And so you don't have to comply with that. And furthermore, the administration has now issued some executive orders on this subject, and in response to that, HHS has rescinded some informal guidance also. So while those regulations are still technically in place, you can, at this point, exclude those services if you're a covered entity. However, I always like to caution that you might find yourself in trouble with the EEOC because the Americans with Disabilities Act can come into play, and also there might be allegations of just general employment discrimination. Okay, so a new and interesting use for the non-discrimination provisions is in the area of weight loss drugs, which we've talked a lot about. So there have been a couple of cases alleging that exclusions of weight loss drugs violate the prohibition for discriminating on the basis of disability. So far, these haven't gotten any traction, but I wouldn't be surprised to see more lawsuits along these lines because there's so much demand for those drugs. Preventive care. So the ACA requires that plans cover certain preventive care services at 100%, and there are a couple of agencies that make recommendations about which services have to be covered, and one of those is the United States Preventive Services Task Force. There was a lawsuit called the Braidwood case in which the district court said that certain of those preventive care regulations were unconstitutional because one of the agencies, the USPSTF, was comprised of volunteers who had not been appointed by the president and confirmed by the Senate. Okay, so the Federal Circuit Court of Appeals agreed with the district court. There was a nationwide injunction. Originally, it was a nationwide injunction, but then the circuit court scaled that back. And then in June of this year, the case made it all the way to the United States Supreme Court, and they actually overturned the lower court decisions and said that that task force is constitutional because it's comprised of inferior officers who don't have to be appointed by the president and confirmed by the Senate, as long as the principal officer they serve under, in this case, the Secretary of Health and Human Services, has been duly appointed and confirmed. As an aside, I wouldn't be surprised to see this task force completely dismissed. Secretary Kennedy did that very thing with a different agency, the one that makes recommendations on which vaccines have to be covered at 100%. And then employer reporting. So this is one of the most onerous parts of the ACA from an employer perspective. And this is required of self-funded plans and large employers. It's those forms that you have to submit to the IRS every year, and then in the past you've had to submit them to your employees. Well, we've been really hoping that Congress would simplify these requirements, and they have in a couple of different ways, maybe not as much as we would have liked, but you no longer have to provide forms to your employees unless they ask for one. You do have to provide notice that they can ask for one. And then in submitting the forms to the IRS, if you don't have the Social Security numbers for all the dependents on your plan, then you can use their dates of birth instead. You don't have to track those down. Okay, a few more examples of what could possibly go wrong. In advertising, so I mean, there's just something really wrong with the scale of this ad. How big is that watch? And I mean, were they really surprised? Come on. And then when you want to demonstrate that this is a co-ed staff relay, and you can't think of another way to show that that's a man. And then, believe it or not, this is an ad for a real estate agency, and whoever created the ad apparently took a page out of like a kidnapper's book where they cut the letters out of a magazine and glue them on another piece of paper. The end result is not good. And then if you're a reporter on the street, you know that things can really go sideways when you're interviewing kids.
Around the area because they have a full weekend, then a day, and then the 4th of July. Here's an actual customer out here. What's the best kind of fireworks to buy?
Wouldn't you like to know, weather boy?
And another one.
Back here live at the Waterfront Village with my friend the zombie, Jonathan. You're looking good. Jonathan just got an awesome face paint job. What do you think?
I like turtles.
All right, you're a great zombie. Good
He likes
here
turtles.
at the Waterfront.
And then possibly the very best example that you could think of for what could possibly go wrong when you're going to a Coldplay concert with someone you shouldn't, and you wind up on the kiss cam. All right, that's all I have for you. Any questions? Thank you.